Fever blisters. Stink. Do you get fever blisters? They are no fun. We're going to talk today about fever blisters and the herpes simplex virus and some holistic treatments you can do to help you if you get them, and also help you understand the transmission, where they come from, triggers that cause them, and some treatments that you can use to help you in getting over when they pop up. So let's get started. My name is Becky Moore. I'm a dental hygienist, passionate about patient care, educating you, and the owner of Restart Hygiene Tea Talk. So let's do it. All right, come on in. All right, so fever blisters are caused by the herpes simplex virus type 1. So HSV-1 is the official name. And we're going to talk about how it spreads. And so first of all, know that the symptoms of a fever blister, if you've never had one, is tingling, burning. I call it throbbing as well. Feel like you have a little heartbeat through it, as well as swelling and fever. So there's sometimes a little bit of fever on your lip. It can sometimes involve your lymph nodes, especially that initial onset. So we want to be mindful of that as well. So how do you get herpes simplex virus? One, by a donor. Usually that donor is our parents. We usually have our first outbreak when we're pretty young, and it happens whenever the fever blister actually oozes out the pus or the blister pops. That is the most contagious time for a fever blister. So we want to be very careful that if we have a fever blister, that we keep our fingers off of it and we don't stick it in our eyes or some part that can get the virus and cause us a lot of problems. So be mindful of that. Usually the primary infection is when we're young, like I said, and you will have a more dramatic response. Your body will more dramatic to the response. Usually after the primary infection, your body learns how to deal with it, and it's a little more expected. You expect how it's going to do for you. It remains dormant in your body forever. So once you have that herpes virus in your body, you have it forever. Whether it comes out or not, it just depends on you and your triggers. So let's talk about common triggers. So various triggers can cause the herpes simplex virus to come out in a fever blister form on your lip. So number one that we're going to talk about is stress. Emotional or physical stress on your body can cause your body to react. Your immune system is affected, and so it can cause your body to react in that way. So fever blister will pop up. So making sure that you manage your stress, if you are prone to fever blisters, can certainly help you. Next one is sun exposure. That is usually my trigger. I brought this little beauty back from Florida this week. Started tingling and burning and throbbing on Thursday night. I'm like, yep, I have a fever blister. And so it can come up in a very short period of time. So protect your lips with sunscreen, lip balm on your lips when you're out there. I use Blistex with the SPF of 15, the sun protection factor of 15. So when you're in the sunshine, especially if you know you have a fever blister problem, to make sure you protect yourself. And the next one would be illness or fatigue. So if your body is sick, your immune system is down, you're going to be more likely to have an outbreak of herpes. And prioritizing your self-care can really help minimize this, okay? So if you know you have fever blisters, avoid those triggers. Also, chocolate is a trigger. So if you love chocolate and you tend to have fever blisters after you eat much chocolate, then just notice that, and that can help you prevent them hopefully in the future. So, all right. So there's different treatments you can use. Traditional treatments would be the ones that your dentist would give you or your doctor would give you. More holistic treatments is what I like to use. More natural ingredients is what, can be very helpful as well. So we're going to discuss those now. So lysine supplements. I've had patients who had really bad problems with fever blisters, and they took a lysine supplement daily, and that helped keep their fever blisters away. So lysine is an essential amino acid that helps inhibit that from growing. So we want to make sure that we don't allow the herpes simplex virus to replicate, and this will help you to have less fever blisters. So that would be a preventative measure. So that would be something that you would do to avoid fever blisters. Now, if you know you got one coming, it's already up on your lip, then there's other things you can do holistically that can help you. So the lemon balm is an herb of the mint family, and it possesses an antiviral property that can aid in managing fever blisters. So that's a good way to do it. The other one is echinacea, which is an herb renowned for immune boosting properties. These supplements can help the affected areas and reduce the duration, because most fever blisters are going to last you 5 to 7 days. So you can use lysine is the preventative measure. Also the lemon balm or the echinacea. So those are 3 options to use as a natural, more holistic treatment. I like to use my Blistex. I use a Blistex. When I feel it coming on, I just keep it coated, and that tends to help it not get so bad. So if you can find something that works for you. Now, if you do have them bad and you wanted to get something from your doctor, that would be more of a traditional treatment. And that can be topically, or that can be by taking a pill. So the topical creams would be a cyclovir, or the ducanosyl. I always say that wrong. So that can be some ingredients in the products that the doctor can prescribe you that can help you with helping the fever blister heal faster as it can. So they would prescribe these from your doctor. When you first felt the first tingle coming on, that's when you would take these prescription medicines. And then there is one that is by mouth, and that's the antiviral. So that would be a different kind of medicine. So either topical medicine or a pill form, which would you ingest. So that can help you. That would just reduces the duration, helps it to heal faster. But once it starts coming up, you're bound to it. There are some lasers that you can get your dentist to do for you as well. If they laser that, there's been some studies that show that the blister will not come back in that same spot again. So I guess if you give a fever blister all over your mouth and you get the laser on each surface, then eventually you won't have any fever blisters. So that might be something you can consider talking to your dentist about and see if that's something that can help you for future outbreaks. All right, so fever blisters can be managed if we know the triggers, which we talked about. Transmission. So if you're a mother, you know you have fever blisters, don't kiss your baby. Don't share those utensils. Don't share towels where you wipe your mouth and the little blister pops and you're sharing that. So be very mindful of that. Keep your hands off of your fever blisters. This can cause transmission to the eyes, to other parts of your body, and that can cause you a problem. I have a friend who has had that issue in her eyes, and that is not something that you ever want to deal with. So be careful with that. And then just try to take care of yourself. Too much of anything is not good. So too much sunshine is not good. Too much chocolate is not good. Too much stress, too much sickness is not good. So do the best that you can as far as that goes. And manage those fever blisters. If you have a real bad problem and the more natural ways don't work, then of course get your dentist to write you a prescription and see if those can help you as well. So until next time, have a good afternoon.